welcome to the We Talk Health podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is Dr. Lee Murray. He is a neurologist at West Tennessee Neuro here in Jackson, Tennessee. Dr. Murray, how's it going?
Doing well. Thanks for having me.
Absolutely. Thanks for coming on. Today is May 27th. Squeaking this in May, but May is Stroke Month, so we wanted to get this one in and talk about it a little bit. Before we do that, help me get to know you a little bit better. What do you like to do outside of work? Tell me about your family. You have any dogs? Do you like to go fishing or whatever?
So I've been here in Jackson for going on 11 years, originally from southern Missouri.
Okay.
Married to a beautiful, wonderful wife with 2 kids that really want a dog really bad. But I haven't buckled down to get it for them yet. So
nice.
Time outside of work is definitely taken up with family, which is wonderful.
That's amazing.
Absolutely.
Speaking of dogs, I just got one a week ago, so I'm dealing with the whole puppy.
You're going to give my son a lot of ideas now.
Yeah.
So, yes.
I will not say anything else about that to not give him any more. So thanks so much for coming in. I know you're a neurologist at West Tennessee at West Tennessee Neuro. So if you could kind of give me a layman term definition of what a neurologist is.
Sure. So a neurologist is a physician that is specialized in diseases and disorders of the nervous system. So that includes brain, spinal cord, peripheral nervous system, as well as muscle.
Okay.
And so anything to do with the nervous system, disorders of the nervous system, that is what a neurologist would take care of.
Gotcha. Was that extra schooling on top of medical school?
Sure. So you do 4 years of college, 4 years of medical school. I did a 1-year internal medicine internship, and then a 3-year neurology residency, and then I did a 1-year neuromuscular fellowship.
Wow.
Even after that. So total of 5 years of training after medical school.
Okay. You said you've been here for 11 years.
Yes, sir.
Did you start in Jackson with your neurology?
That's my first job. This is my first job out of fellowship, yes.
Okay. Wow. You've been in it for a while. I'm honored that you're here.
Time flies.
Yeah, for sure. All right. Well, so let's talk about the Primary Stroke Center just for a second. What kind of services do you guys offer?
Sure. So the Primary Stroke Center that we have here at Jackson General is accredited through a nationwide accreditation. It's called the Joint Commission that accreditates hospitals on various different levels for different things. And so in order to get accreditation, you have to meet certain high standards for quality of care, accuracy of care, quickness of care. And so we went through this process to become accredited right when I came here. So right about 10, 11 years ago is when we got our accreditation. And the stroke program here at Jackson General has just increased exponentially as far as the volume is concerned. We're one of the busiest stroke hospitals in the entire state of Tennessee, and a lot of people would not really realize that in Jackson, but we actually are. So, I mean, some numbers, we see about 1,200 acute strokes a year. About 200 of those are hemorrhagic strokes, and then about another 200 or so what we call TIA type events is what we typically treat. So a large volume. So with the accreditation, we have to constantly get reaccredited. So we have independent auditors that come in and look at our numbers, look at our data, and give us the accreditation that we need to assure the community and the folks that we serve around here that we are doing a top-notch job.
That's awesome. So a second ago, you said 2 terms that I am unfamiliar with, being non-clinical. You said acute stroke and TIA.
Sure. So acute stroke is where someone has had a stroke-like event.
Okay.
So they've developed facial weakness, they developed an arm weakness, leg weakness, paralysis, within a matter of minutes. And the key thing we are trying to highlight with Stroke Month and stroke awareness is that people, if they see somebody or they begin having symptoms themselves, to seek care immediately. And so with us being a primary stroke center, we have the capabilities of at times reversing stroke damage before the damage actually occurs. And so one of the key things is that when someone comes with an acute or a new onset of weakness or speech changes that they present to they actually call 911 immediately. And then they'll bring them in here to the hospital where we can potentially administer clot-busting medications. And we will also do a series of scans looking to see if we can actually visualize the blood clot in the brain. If we can see the blood clot in the brain and the scans look correctly, we have the ability here to have the interventional radiologist actually go in through the groin, put a catheter up into the brain, pull the clot out, and try to restore blood flow to the brain before it is permanently damaged. But again, for all that to happen, the key thing is to get here early, and the best way to do that is usually to call 911. We have worked great with our EMS fire department folks, not just in Jackson, but even the surrounding communities, to recognize stroke and to get potential stroke patients here to Jackson General as quickly as possible. So that's why we always kind of advocate for folks to call 911. That way that process can begin immediately.
Absolutely. If I understood it correctly, essentially a stroke is a blood clot going to the brain?
There's two different types of stroke. So one is a blood clot that is into the brain that is restricting blood flow to a certain area of the brain, which then causes damage to occur. The second type of stroke is a hemorrhage or a brain bleed. Those are managed differently, but that is also considered technically a stroke as well. And again, all those things we manage here at Jackson General.
Gotcha. Perfect. So what are some signs and symptoms that people should look out for?
Sure. So the acronym that we like to use is BEFAST, B-E-F-A-S-T. So B is for balance. E is for eye movement. So if you have difficulty with your vision, lose vision in your eye, get double vision. F is face, so facial droop, any kind of facial asymmetry. A is arm. You can put leg in there too, so arm or leg weakness, arm or leg numbness and tingling, especially on one side. S is for speech, so if someone all of a sudden cannot get the words out, they're talking gibberish, nonsensical things, words are not making sense, they're not answering questions appropriately. And then the T in the acronym is time. And again, that's what I want to continue to emphasize. The key thing is time. Time is brain. And so the quicker the patient arrives to a certified stroke center like Jackson General, the more options we have of potentially trying to treat that patient. Gotcha.
So do strokes happen more on one side of the brain than others? Or?
No, it can happen on either side.
Okay.
It can happen on either side. So you may have a patient who has got speech changes and right-sided weakness, or they may have left-sided weakness. If it happens in the back of the brain, they may have more of a dizziness, balance type problem. So it all depends what part of the brain the stroke is occurring in.
Gotcha. So we know it's important to call 911 if you think you're having these kind of symptoms. Can you tell me exactly why that's better as opposed to a family member driving you?
Sure. I mean, if you're right next to the hospital, yes, don't just go ahead and bring them on in. But again, EMS has been well trained in recognizing stroke and getting them to an appropriate facility that is able to care for the patient. So at times there's a lot of things that EMS can do as far as stabilizing the patient, as well as some folks who are having a big stroke may need help with breathing or things like that. So EMS can even stabilize a patient who may be having a significant event in the field, which of course you would not be able to do that in your own private vehicle.
Sure. So what are some treatments that can be done for a stroke? And earlier you mentioned time, so this is a two-part question. Earlier you mentioned time was one of the more important parts of this. Is there a certain time frame that things happen?
So typically, for the most part, we need to have an idea of onset of symptoms within about 4.5 hours. Now, there are some other criteria that bring it down to 3 hours, and so that's why whenever a patient comes in with stroke, one of the big things we need to know is when did this happen, or if we don't know when it happened, when was the patient last seen normal. So for acute stroke, for a stroke that is actually occurring, we can administer a drug called TPA or Activase, which is a clot-busting medication. But that has to be given within most time a 4.5 hour window, at times 3 hours. There's certain criteria with the differences there. But this is why it's so important to get here quickly. So if a patient arrives to the hospital outside of that window, the TPA or the clot-busting medications would not be an option. This is why why it's so important to get here quickly.
What if they don't get there quickly?
So what we can do, especially if we think the stroke has happened within a 24-hour window, we will do scans, a special CAT scan called a CT perfusion study, where we'll actually inject dye into the patient and actually get a good look at the arteries in the neck and the head, and we are looking for the actual clot. And then we have special computer programs that can show us if the brain has actually already had the stroke or is at risk of having a stroke.
Wow. Okay.
If it looks as if the area of the brain is at risk of having a stroke, we can visualize the clot. Then what we'll do is have one of the interventional radiologists go in and actually try to pull the clot out of the artery, restore blood flow to that area of the brain, and hopefully restore function to the patient. If the patient arrives, outside the windows for any of those type of procedures, or if we can't see a clot, at times strokes can happen in the small vessels where you don't really see the clot itself. A lot of times you end up treating it with medicines like aspirin, some other kind of blood thinners called clopidogrel or Plavix. If a patient has got an irregular heart rhythm, we may place them on more potent blood thinners to try to prevent stroke.
Gotcha,
So a lot of times folks who come in with the acute stroke, they may not qualify for the clot busting medication or the radiology procedure to pull the clot out. But the big thing is trying to find why did the stroke happen.
Sure.
And then trying to try to mitigate any type of risk factors the patient may have for another event to occur. And so whenever the patient gets admitted to the hospital, the neurologist, the internal medicine, family medicine folks, we're trying to find these causes. Is it because of high blood pressure? Is it because of diabetes? Is it stroke because of smoking? Is it because of some type of genetic predisposition to blood clots? Does the patient have an irregular heart rhythm that puts them at a higher risk for an additional stroke in the future? And then we put them on different medications to try to mitigate those risks according to whatever we find.
Gotcha.
The other key thing that we have here is we have very aggressive rehab folks. And so
a
key part after the stroke has occurred is trying to get the patient back to a normal life as much as possible. And so we begin the rehab process with physical therapy, occupational therapy, speech therapy in the hospital. And then a lot of times folks will go out to a rehab facility for a couple of weeks. And so, but that is started actually in the hospital itself.
Gotcha. I had no idea. That's cool. The medications that they're on, are they going to be on those medications pretty much for life?
Usually so.
Gotcha.
Yeah. Okay. The risk factors are things that we have to manage lifelong. But there's a lot of things patients can do themselves. I mean, one of the biggest risk factors for stroke is smoking.
Sure.
Which is it's a horrible habit. It's a hard habit to kick. But a lot of this we can put medications to try to lower those risks, but some of it has to come to the patient's compliance, not smoking, eating a heart healthy diet, watching blood sugar, diabetes, watching blood pressure, following up with primary care, making sure that those things are in check. So there's things we can do as physicians, but there's things that patients can do as well to help themselves.
Essentially have to do their homework.
They have to do their part. We do our part. They have to do their part as well.
Sure.
Yes.
Okay, so if there's one more statement that you could say to like really drive the point in about stroke importance and stroke awareness, what would that statement be?
Time is brain.
Time is brain.
Time is brain. And so if you have symptoms, don't wait to see if they're just going to go away. They may, but they may not. And one of the big reasons why we're not able to treat a lot of patients who come in with stroke is because they come in too late.
Gotcha.
And they're outside the window for anything to be done. So if you have symptoms, call 911, get to an emergency room, and the options that we have will be a lot greater than if you wait around to see if things will get better on their own. Do not do that.
Good to know. Are there any resources that people can look up online?
Sure. So American Stroke Association, which is a division of the American Heart Association, so stroke.org is a very good resource. And talk to your primary if you have a history of stroke in the family. You have questions about stroke risk factors. Talk to your primary care physician about it and get testing done appropriately.
Perfect. Stroke.org. I'll put that in the description. So listeners, if you want to try and find that, there'll be a link at the bottom for that. This is great.
Thank you
this
so
is
much.
short, sweet, to the point, but it was all really good information.
Very
so
good.
thank you
Thanks
so
for
much.
having me. Appreciate it.
Absolutely.
Thanks a
Thanks
lot.
for coming in. And this has been another episode of We Talk Health.